Conversations That Matter is a partner program of the Center for Dialogue at Simon Fraser University. The production of this program is made possible thanks to the support of the following and viewers like you. It hurts to look at this young man. You can't help but wonder what's wrong with him. Why is his back so twisted, and what can be done to help him? Dr. Rick Hodes wondered the same thing. Every year, children with scoliosis and tuberculosis of the spine show up at his clinic in Addis Ababa to see the man they believe can make them straight. Dr. Rick Hodes, welcome to Conversations That Matter.
Thank you.
Or maybe I should call you an angel on earth. I've looked at the work that you do, and I think that you are an extraordinary person in not only the results of what you do, but what's motivated you to do it. To anybody who's watching this show, tell me about your life and the work that you're doing in Ethiopia and in Ghana.
Sure. So my name is Rick Hodes. I'm from Long Island in New York. I've been a doctor in Ethiopia for 29 years. I'm the medical director of an organization called the American Jewish Joint Distribution Committee, 102-year-old New York-based organization. But I'm posted in Ethiopia. Over the years, I've worked with refugees in Rwanda, Zaire, Tanzania, Albania. I've taught at the medical school in Addis Ababa, Ethiopia. I've been the doctor for 1% of Israel before they became Israeli, the Ethiopian Jews moving to Israel. Right now, my work is completely non-sectarian. I'm the senior doctor at Mother Teresa's mission, just taking care of sick destitutes. And I'm the only spine doctor in all of Ethiopia.
The only spine doctor?
The only spine doctor in all of Ethiopia, 100 million people.
When I was at this presentation that you put on last night, you were showing images of young boys and girls in Ethiopia with spine deformities that I didn't think were possible. Were you shocked and surprised at what you saw? And is that what compelled you to keep moving forward? Or
You know, I like to learn. And now, not only am I learning, that we, mankind, are learning from my patients. So we're discovering new deformities that we never knew existed. Like now we have an alpha deformity, we have a gamma deformity, we have a saxophone deformity. So besides the normal...
This is in the spine.
This is in the spine. This is besides the normal scoliosis, or scoliosis is an S and kyphosis is a V. And these we see all the time. We have all of these other things that it's sort of like spinal deformity on steroids.
Why is it happening in Ethiopia and we don't see those same kinds of deformities here in North America?
That's an interesting question. It could be a genetic issue. It could have something to do with the nutrition. It could be toxic. I mean, it could be some toxin in the environment. We really don't know the answer to that.
But who are these people who are coming to you? What age are they? And then how do you help to realign their life? And their back, of course.
People come to me literally starting at the age of a few weeks when their moms notice some issue. It's known that I'm the only spine doctor in the country, and people come from all over the country to get to me. My policy is everybody gets seen on the day they come. So we sit there.
You must put in some long days.
Yeah. We sit there and we just, we'll see patient after patient. The average age is probably about 7 or 8, and they range from literally 2-3 weeks old to up into their 50s. But most of them are between, say, 5 and 20 for sure.
So what's the process that you go through when somebody is admitted or comes in to see you?
So people come, they walk in. I want to put them at ease. They're nervous. They're going to the doctor in the capital city. They may have never been to the capital city before. They maybe have never had a conversation with a pharynge, a white person, before. They may be afraid of having surgery, which is, of course, a terrifying idea. And so I want to first just make them feel comfortable. So I will ask them their names. I'll ask them about their parents. I'll ask them where they're from. I speak some of the languages, so I'll try to say some words in their language, and then I'll try to somehow make them laugh. One way or the other, I can get these kids to laugh. Then I take their picture. First thing I'll say to the patient, okay, now
You mean their back? You're taking a picture of their back.
Well, that's an interesting thing. Patients think, I say, okay, I need to take your picture, and they'll go to the wall and they'll turn around with their clothes on facing the wall so I can take a picture of their back. And I say, no, 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 we start from the front.
Why have the face?
That's interesting. Somebody wrote a book about me called This is a Soul, The Mission of Rick Hodes. She was in the room, the author, Marilyn Berger, was in the room, and she heard somebody say, why don't you just take a picture of their back? And I said, this is not a spine, this is a human being, this is a soul. And so the first thing I want to do is show who the person is. Then I want to show who the whole family is. Then I want to see, then I undress the patient and I take 20 pictures in different positions in a very ordered way. To illustrate the degree of spinal deformity.
And do an appropriate diagnosis from there.
Right. So then often I can make a diagnosis just by my exam, but then I will do x-rays. We do what's called a PFT, pulmonary function test, a lung test to see how, because what happens is when your spine collapses, your lungs collapsed. And so sometimes people have lost 75% of their lung function. And that actually may be more dangerous than their spinal deformity, because if they get a pneumonia, they have no reserve, and then they can die. Yeah. Wow. So, and then I'll do a neurologic. I'll check their reflexes. I'll check their toes. I examine their feet because that somehow is part of the big picture. And then I'll give them some idea of what's going on. Of course, we get x-rays on all the patients. And then I'll give them some idea of what it is, what we might be able to do, and make some sort of plan for the future. Do I want to do a CAT scan? Do I want to do an MRI? I'm very stingy about the tests that I order because I have to pay for them. All of my care is free.
You have to pay for them.
I mean, not me personally, but I'm raising money. I use my donor money. All of these people, none of these people are charged, and most of these people are very poor and couldn't afford anything. I mean, literally, I start clinic every day with 40 hard-boiled eggs. And when patients look hungry, again, I don't want to say, you look hungry, eat some eggs. So I'll say, can I ask you to do a favor for me? And they'll say, yeah, what? And I say, I have so many chickens in my house. When I wake up in the morning, it's just filled with eggs. I have to give them away. Will you please take some? And they'll say, yeah, okay. And I give them half a dozen eggs. And so literally, I see patients who are hungry. We have, I mean, for example, literally in my bathroom, I have a duffel bag filled with shoes. And when I find cheap shoes, I just throw them in. And somebody comes in, you know, with size 39 shoe, who just has terrible shoe, I'll say, come back tomorrow, and we'll bring them a new pair of shoes. So these are very, very poor patients who need a lot of assistance.
So you're not caring just for their back, you're caring for them as a whole person.
Exactly, exactly. Not only that, if they need a place to stay, I mean, some of these people, the ideal situation, A, would be somebody from Addis Ababa, because then housing is not an issue.
They can go home.
Or B, somebody with a relative. You know, you can come from 300 miles away. If you have a cousin in Addis Ababa, that's fine. And Ethiopians are very hospitable when their out-of-town relatives come, so that works out perfectly. But a lot of my patients may come from 300 miles away. I mean, and literally, I'll say, where do you live? And they'll tell me the name of the town, and I'll say, how many hours? And then I'll say, wait, we need to get this properly. How many hours by bus? And then how many hours by foot? Or how many hours by donkey? Because you may have to go a day and a half by bus, and then a 3-hour walk or a 3-hour donkey ride.
So these people are coming to see you because they've heard of you.
Yes.
But what kind of resources do you have to actually treat them? I see that I understand that you can bring them in, you can diagnose them, but how do you treat them? Where do you get the resources that you need to be able to do that?
So I myself am an internal medicine doctor. I'm not a surgeon. However, I can't do what I do without a lot of friends and a lot of partners. So my partners are some of the finest surgeons in the world. So for example, the person who I consider the top spine surgeon on the planet is a guy whose name is Dr. Boachi, Oheneba Boachi Aje, who is in Accra, Ghana. And so Dr. Boachi comes to Ethiopia several times a year, and I send patients to Ghana all the time. I mean, literally right now, I have probably 20, 25 patients in Ghana who are getting treated. I have another team that comes from Chicago. Kamal Ibrahim Kamal and his team come from
From Chicago.
Right. There's a Vancouver doc named Feroz Mianji who's coming out in May as well as part of Kamal's team to operate. And we have people who come from Texas. And then every now and then I get a phone call saying, I'll do a case for free. Saying, can you get me a kid in San Francisco? So right now I have a boy. I flew to America a few weeks ago anyway. So I brought this boy with me in Newark Airport. I put him on the plane to San Francisco. He just had successful spine surgery in San Francisco.
How do you do that? Actually, before we get to that, you also have a connection with UBC as well now. Like you have become an international organization.
Oh, for sure. So the branch for international surgery at University of British Columbia is a huge supporter of mine. I am a supporter of theirs. The dinner that we're having in June is raising money not only for me but for them as well. And they have their own projects in Ethiopia to help improve the health of the Ethiopian people.
Wow. So how do you get these young people to San Francisco and Chicago and to these different places around the world to get treated? Like where do you find the ability to move them around and make all of these connections? How does this stuff come together?
So I mean, I'm the only doctor right now in Ethiopia on my team. I have 2 full-time nurses. I have several assistants. I often have a volunteer as well. And all of these moving parts are dealing with, you know, so for example, we have this kid named Dawit right now in San Francisco. We needed to get him to San Francisco. So we have one of the team will work on his passport, will work on his visa, because none of these people have passports. None of these people have visas. And so all of these are major, major steps.
And they have to be able to communicate as well. So they must
Right.
not travel on their own. Is there
Well,
somebody
it
that
depends.
travels with them as well?
So to Ghana, you know, often there's people going back and forth to Ghana anyway. To America, I actually flew with Dawit myself. I had to go anyway, so we worked it out and got his visa at the last moment. And so he and I flew together from Addis Ababa to Newark Airport. And then I put him on the plane himself from Newark to San Francisco, but then he was met by an Amharic speaker in there. And I have to raise money for all of this as well. So really I have to raise, you know, hopefully $2 million a year to keep this whole thing going.
Where do you find your connections? And I asked that because I heard you tell this wonderful story last night about not being able to do your morning prayers, and you went to the synagogue, and there you meet this man. Could you share that story?
Yeah, it's a remarkable story. It's really one of these things that you somehow think, well, God wanted us to meet. Because I'm an observant Jew, and I do morning prayers every morning. I woke up that morning too late to do my morning prayers. You know, this happens to all of us sometimes. So you throw your clothes on, brush your teeth, and you run out of your building. And after my first meeting, I said to the guy, take me around. Do me a favor. Take me to a synagogue. I want to do prayers properly. This is in Minneapolis. So he took me to a synagogue in Minneapolis, and I sat down and said hello to the guy sitting next to me. And I just, you know, said, what do you do here in Minneapolis? And he said, I'm a neurosurgeon. I said, oh yeah, do you have a specialty in neurosurgery? He said, well, it's very specific. It's called skull-based neurosurgery. He said, I specialize in the bottom of the brain. And I said, where were you trained? He said, I was trained in the best program in the world in Ottawa, Canada. So I said, oh, good for you.
Yep.
So he said, what do you do? And I said, I do tropical medicine in Africa, but let me show you something. So I opened up my computer in the synagogue, and I'm showing this guy images and CAT scans of this woman with it looked like an ice cream cone growing out of her eye. She had a tumor the size of an orange in the middle of her brain, and nobody would touch her. And
because they were
terrified
yeah.
of operating on somebody like this. And he said, oh my gosh, I've never seen anything like this, but I'd love to help her. Because of that chance meeting in synagogue, we stayed in touch. He gave me a date 6 months later when 3 different doctors were going to take a day off to help this woman for free. So
for free.
For free. So he himself is a skull-based neurosurgeon. There was an oculoplastic surgeon. There was a craniofacial surgeon. St. Joseph's Hospital in St. Paul, Minnesota donated all the hospital care. And so
for
here you have
from Ethiopia.
So you have a Muslim patient from Ethiopia being operated for free in a Catholic hospital by a Jewish doctor. It's a wonderful story of how the whole world cooperates.
What does that tell us about the human spirit?
It just shows that we are human beings, and that transcends everything else. Whether you go to church, whether you go to mosque, whether you go to synagogue, we can all help each other. We can all cooperate. We can all love each other.
Why is it so important that we save people who are in this situation? Like, what does that do for us individually and as a society?
That brings us all together. It creates a world of harmony and love. And in the world right now, 2017, we need harmony and we need love. You know this. In Ghana, what we do is we do something called ambulatory traction. And drill 4 holes in the skull, put a halo around, and then they're being stretched 23 hours a day. They're being stretched when they sit, they're being stretched when they stand, and they're being stretched when they lie down.
That sounds like it hurts.
You'd think so. It only hurts for the first day. And after that, it really doesn't hurt. And so they're in traction for 23 hours
so
a day.
you're literally pulling their spine.
Yeah, you start with 5 pounds of pressure, and then over about a month, you go up to half their body weight. And then you stay, you have this whole spring system and you have a measuring gauge. You stay at half their body weight for some months, 2, 4, even 6 months. And you're going to get a fair amount of correction that way. Then you still have to operate because we live on the earth where there's gravity. But then Dr. Boachi and his team will operate, and the patients come out pretty straight.
Wow. And this changes their lives.
This changes their lives. And so at any time, we're the world's record for traction. At any one time, we have 25 kids in traction. And
25 kids.
25 kids who were going to Ghana 3,000 miles away without their moms, without their dads, 3-year-olds going without their parents, when the older girls will take care of the younger kids. And we have created a therapeutic community. This is another one of these spin-offs. So these kids who were rejected by their peers, who were taunted in school, now have a Facebook page, they have a club, they have a community that they have formed. And it's really wonderful just to see this. And they stick together. And they even, one of the things I've noticed is they even show up in clinic. And I'll say to my staff at the end of the day, you know, Ababa was in clinic today, but he didn't, I saw him when I walked out to go to the bathroom, but I didn't see him in clinic. And they said, oh no, he didn't come to see you. And I said, why did he come? He said, he came to meet his friends. You know, that they'll meet in clinic and then go somewhere from there.
So you're creating a new community.
Yeah, we're creating a therapeutic community.
Now, it's my understanding that you also have said to some of these young people that you've treated, you have nowhere to go, come home with me. That's a huge commitment.
So how did I become a spine doctor?
Yeah.
In 1999, I met 2 abandoned orphans with tuberculosis of the spine in the room for sick, unadoptable kids at Mother Teresa's mission. I wanted to help them.
That's what the room is called.
Well, I mean, that's it's for a room for sick kids, but none of those kids are ever put up for adoption. And I wanted to help them, and so I got my brilliant idea that I could adopt them, add them to my American health insurance, and get them surgery that way. So I went ahead, I thought about this.
This is a legal commitment.
This is a legal commitment, and you know, we all know in every country you can have a marriage for a few years and help your partner get a green card or a passport and then go on your separate ways. When you adopt an orphan with no relatives, they become yours for life. So the calculus was, I could adopt them and save them medically, but then we'd have to spend the rest of our lives together.
So you better like them.
Yeah.
Yeah. Obviously you do.
And I thought about this, and then I felt like God was sending me a message. And the message, it was sort of like I was walking along one day and it was like a light bulb went off. And it said, the Almighty is offering you a chance to help these boys. Don't say no. So I went ahead and adopted them, brought them down to Dallas, Texas. And again, even like after I adopted them, finding a surgeon was a big deal. But I brought them down to Dallas. They had surgery in Dallas. Another one came along and I did the same thing with him. But serial adoption is clearly not the answer to spinal deformity.
No.
So a few years later, I met Dr. Boachi, and then now I send my patients to Dr. Boachi. But it's more than that, because now we're training Ethiopians to do spine surgery. We have teams coming in, so we have a whole momentum going forward.
So what's the single greatest need that you have? If somebody's watching this right now saying, you know what, I think you are a member of God's army and I want to help you. What's the most important thing that they can do to help you?
Well, if they're a spine surgeon, they can give me a call. If they're a regular person, they can go to my website, www.rickhodes.org, and contribute. Or they can come to our dinner.
Here in Vancouver.
Here in Vancouver in June.
Yeah, but it's financial support and also medical support that you need to be able to help these children.
For sure.
Wow. How many lives do you think that you've had a positive effect on through direct intervention during the course of your work?
Oh, I mean, thousands and thousands. I've been the doctor, for example, in Kibumba refugee camp in Zaire. I was the doctor in charge of the health of 50,000 people, running a 300-bed hospital. But
wow.
Right now, even just in the spine world, where I'm the only spine doctor, we've gotten 600 surgeries up until now. And we've evaluated well over, coming up to 3,000 people or so.
Who knows what the impact of all of that will be over time, because you've changed the course of these people's lives.
I mean, one of these kids who came to me 10 years ago and didn't want surgery. This is a kid, educated dad. He said, I don't know what to do. My 16-year-old son refuses surgery. And I wasn't sure what I was going to do, but I said, tell you what, come to my house tonight at 6 o'clock. We'll talk about it. The dad and the son came to my house at 6. The dad and I sat on the couch to drink tea. My son, Dejeni, who had his own spine surgery in Dallas, walked in. I said, Dejeni, take this kid out into the front yard, talk to him about surgery. So these two boys, teenage boys, went out into the front yard. They talked alone about surgery for a half hour. The kid came back later and he said, I want spine surgery. We sent him to Ghana. He came back, successful surgery. His dad said to me the next year, I noticed my son never smiled before his surgery. Now he smiles all the time. Okay, I didn't hear from the kid for years. Last year, the dad called me. He said, I need to see you. He and his son showed up at my office. His son shook my hand. His son just graduated from medical school.
Oh my gosh.
Isn't that fantastic?
That is fantastic. Thank you very much for the incredible work that you're doing and for being here.
Thank you.